I've been coming to you for over a year now.
Yeah, it's been about 3 years.
Yeah.
So let me introduce myself for
perfect.
our future viewers and listeners. And so, hi, my name is Dr Hyokyung Kim. I'm Korean medicine doctor located in Seongsu, Seoul, South Korea. And I'm also a founder and director of Duna Korean Medicine Clinic. And every day I'm focusing on helping my clients restoring their healthier wellness lifestyle back with Korean medicine tools every day.
Yeah, absolutely. And like I said, I've come to you for. I first started coming to you because I was getting Botox in my.
Yeah, you told me you had some entrapment around your trapezius muscle. I totally remember at the moment.
Yeah. And so then, but that was giving me like crazy headaches, and so I'm like, okay, this isn't.
So every time you came to our clinic, I always ask about how's your migraine going.
Yep, totally. And I was having crazy migraines, and I couldn't sleep, and now when I tell people that I was getting, it was a little bit kind of divisive. People are like, why were you getting shoulder Botox? Like, that sounds crazy. Like, of course, that's going to cause other issues. And then some people are like, oh, well, does it work? Like, so yeah, I've done acupuncture with you. I've done Duna with you. I've done cupping with you. I've done like nutrition, diet management with you.
Also like pain-free herbal injections along with that.
Yeah, those are really incredible, actually. But so maybe give me a little bit of background on you. So I know from a mutual friend, Suyeon-nim, 사랑해요.
Yeah, she's my high school bestie.
Yeah, so she would tell me that like in high school, if it was like, study season or like you had tests coming up, like she would always like, you would always like.
Yeah, I always like press the acupressure on like digestion and focusing and mental stress care. And I always curious about what I'm going to do with these strong hands.
Yes.
And Suyeon was curious about that too.
Yeah, so that's how it started. You're like, I got strong hands. I got to put them to use. You're like, construction, no, I'm going to do Haniwan. So, but like, were you like growing up like as a kid? Like, were your parents?
So basically, I was born and raised in Seoul, South Korea. And back in the days, I was like not that strong. Like, basically, I was so weak at my digestion. And it always bothered me when I wanted to focus on my studying and career and exercise. And then whenever I went to hospital, there was no clear like outcome or result. Even they did numerous tests, and the answer was always normal. So maybe from that, I start to look up for more holistic care that really helped me to improve my health in real life. And then I started to study Korean medicine since 2017. Like,
wow, long time.
Yeah, and I became a Korean medicine doctor since 2017, and I've studied Korean medicine since 2011. So it's been about like 15 years. Yeah.
But I feel like you probably, even before that, like had exposure to it.
Yeah, so I went to like Korean medicine doctor, and she explained the details about why I had so much like discomfort on my digestion and like pain and neck pain like that. But it wasn't actually was like problem around the digestion or neck like that. It was about circulation, and it was about like deeper problems. So after solving that problem, I got so much better. So now at the moment, I stepped into more open to Korean medicine.
I was kind of surprised at how much focus is on like digestion, inflammation. And it felt like and this is like everywhere, like no matter who you talk to.
Yeah.
It's kind of like just like ingrained in people that are like, well, are you sleeping well? Are you eating well? And I'm like,
yeah, they just focus more on generally on like wellness, and not even for wellness, just about health.
And kind of like the basics, right?
Yeah.
Like, are you sleeping good? Are you eating well?
Even though when you start your conversation, start with 밥 먹었어.
Yeah, exactly.
먹었어. What did you eat?
Totally. When I first came here for my consulting job, I would like walk in the morning and be like, good morning, how is everyone? And they're like, leave us alone. Like, what are you talking about? But then they would be like, what, like, oh, did you eat? And I'm like, what does that matter? Like, so
Totally.
just that like that ingrained in like the culture here was so, it's just very telling on like what's valuable here. Like
What's the matter?
what's the matter? Yeah, exactly. And I always thought that was just super interesting. And now I think in the US, I mean, I think it's a interesting time in the US, but I think more and more people are realizing that there's a lot of gaps in that healthcare system, and it's
Like gray gap.
exactly like there's just basic things you need to take care of that I think there's more value put into like your diet. Are you sleeping? Just is your body well in Korea? And so I think that's something that I can really relate to a lot of people that want to come to Korea to try traditional Korean medicine. Even if it's, whether it's for like inflammation or if they're not sleeping well or if they're like, I just saw K-pop Demon Hunters and I want to know like what it's all about.
So basically, Korean medicine has thousands of history of years on Korean peninsula.
Like literally thousands.
Yeah, so it's strongly focused on like preventative medicine.
Preventative.
Yeah,
Exactly.
So, and it's also, everybody knows about that. Like there is a Korean medicine, but they don't know about it's part of the national health insurance system.
Totally.
Yeah.
I was blown away by that. I was like, what?
Yeah, whenever I talk to like my known Korean client coming from abroad, and when I tell, you can cover by national health insurance between 10 times a year with correction, and you can get like 70% discount without limitation for acupuncture, and everybody's just surprised, and everybody's telling that how like lucky.
A preventative society will like knock an American on the floor. Like it for me, the first time, even like I had to have stitches in my finger. And the first time I went, I was like, this is what it can be like.
Yeah.
I'm like, why did I not wait in a waiting room for 7 hours? Why is it not $3,000? Like I couldn't wrap my head around preventative healthcare. Like it's a game changer.
Yeah, it's like the most of like adults are like at least 60% of Korean adults have visited Korean medicine at least once in their lifetime. And most of like clients coming to our clinic is not influencers.
Yeah.
Yeah. Most of our are just locals in Seongsu or office workers. Yeah, they just live their life, and they just normally come to Korean medicine clinic for daily care.
When I first started coming to Duna, I think I was usually like the only 외국인. I was the only foreigner there. And like now it's kind of, I feel like when I go, sometimes I'm like, it's half and half.
Yeah, it's like packed with.
There's so many people, and like, you've had
luckily, it's thanks to you, actually.
Well, I mean, I think you have a big part of it, but I think you've just grown so fast in such a short amount of time.
So about like global interest, so it was like organic one. So first, the global influencer reached out to our clinic, and they just wanted to share about how they can maintain their wellness life with Korean medicine. They uploaded without any editing or any censor, and it just blew natural attention. And these days, the world globe is seeking for more integrative therapy or integrative care, looking like for whole body, like Korean medicine, not only Korean medicine, just integrative body and holistic way. I think that just brought a lot of attention that everyone who wants to take control of their like body or like wellness can open to Korean medicine.
I think you've told me this before, that you've never done paid collaborations. You like don't really. I mean, you're not like, we don't work with with influencers, but like some influencers, I feel like because it can be so powerful, and because it's so different than anything else they've experienced before. Like people genuinely want to share those
genuinely
stories.
Just wanted to share their story without any paid collaboration. We have never done paid collaboration ever, and
which is crazy because I feel like you've had, not that you've had like so much influencers, like because sometimes clinics can, especially like skin clinics, they can look like they're a tourist trap where it's like, do they only have influencers there? But I think people are just naturally drawn to, like you're saying, like integrative care, something that's, wellness is really top of mind these days. And so I think people really just want to share those stories.
So I think the most of the reason why people seeking the Korean medicine, and it's one of the core value of Korean medicine is about nourishing life. So you can translate it to nourishing life, but in Korean it's called 양생. So which means it's basically living well, digest well, sleeping well, and it's all have to based on your baseline, your constitution. So the idea and concept that you can actually control your health without medication or expensive or luxurious wellness item just can blow people's mind. Like the idea, whenever I say you should control your diet and your exercise based on your body type, and it sounds so new to them.
Because it is new to us.
But for Korean, everybody is just so used to those concepts. Basically, Koreans are just amateur expert at Korean herb and Korean medicine. Yeah, because of the famous Korean drama.
Yeah.
I told you briefly about that.
Yeah, I watched some clips. Yeah.
Really?
Yeah.
It was like back in like 2000s. So about the drama, you should know that. Like for our viewers, they should know that.
Yeah.
Because around my millennial generation, so AJ, can you name any like medical encyclopedia in US?
No.
Yeah. So whenever I ask this question, everybody answer the same 동의보감. So there was a phenomenon about this drama. So it was about a super genius doctor about 500 years ago. And just like King Sejong developed alphabet for Hangul, for Korean people. So Hojun not developed, he summarized about local Korean herbs and Korean wellness treatment or styles based on Korean people's lifestyle. So basically about that drama, there is so much about herbs and like lifestyle and about the food you should try like that. And about that drama, it was like it gained like 60% of viewership at the moment. Like literally everyone knows that drama.
Yeah.
So it influenced the student around that age. So I was one of that. So it's like
So the K-dramas
yeah,
brought you to
so
K-medicine.
K-drama actually not influencing the global netizen at the moment. It was just for us. So it really influenced that. So at the moment, the Korean medicine school is 60-year school, same as medical school in just like normal medical school, was higher than Seoul medical school.
That's crazy.
Yeah.
I also think people don't really realize that too, because like in the US, you can have like a physical therapist that'll like kind of do some acupuncture for you.
There is a acupuncturist and physiotherapist and practitioner for chiropractic. But I heard there Dongguk University, which is my college, just launched like acupuncture school or college there. But I'm not sure there is a 6-year like legit Korean
like an actual, like years of actual like practice.
I'm not sure
training.
about that, but they offer training. They do.
Yeah, because sometimes like I guess it's a little bit different in the States. Like sometimes you associate like traditional medicine with just like herbs, and like there's always some kind of some like basement situation where you're like, is this like what is this? So I think, but also like coming to Duna, I was like, this is. Like it was just so it felt like such a merging of like traditional but also like it was so modern at the same time too, and it just made sense. Like even just thinking about like your diet or like wellness, and I think a lot of times people will
misunderstand
it, or they'll make excuses like, oh, I'm already so busy, and it's like, well, if you think about it, like you have to sleep, you have to eat, like those are two really big chunks of it, right? And then the other part is like taking care of like your mental, like your stress and your mind and stuff like that. So it's like it already fits into things you're already doing. You just have to like be conscious and understand it. Like I will never stop talking about when you told me that I had to eat like gogoma, but then you're like, you have to eat gogoma with like sawa.
Like fiber.
Like, yeah, she's like, if you eat like a sweet potato, like you also have to be eating like the right fiber, otherwise it's not going to digest. And like I'd never thought about eating foods together for better digestion.
Yeah, it's like food combo written in 독립공학. So it's also about food synergy. So once the fiber is too like chunk to digest, you need some extra fiber to make it digest more easier, like that, like a synergy. So whenever you go to Korean restaurant, you may see some posters about how they brag about their
health,
health and the benefits
Exactly.
about what they are selling. Like even for little like pork restaurant, like you can literally see like 10 different benefits of pork.
I know, it's so interesting.
Yeah. So it's like that. So about the modern part of our clinic. So even though the world changes fast, actually our body still doesn't change that much after thousands of years. So it goes like the same balance theory or therapy or principle from years or decades ago can still go with it. So that's the principle. But the difference is that we have to apply them in modern ways.
Right.
And modern situations. For example, we have to sit all day long
The computers.
with computers and
computers.
yeah, and phones. Yeah, you know what? Every time I just go past the L, and then sometimes I tell my clients to please straighten up your spine.
When I recorded with Suyen, we were both like,
Yeah,
we're like, Dr. Kim
don't
tells us
cross
to
your
do this.
leg like that. And it's like bad habits and poor postures or very stressful moments we are carrying.
Oh, yeah.
Yeah, to approach that more practical. So we also using like modernized tools like AI to approach client more like understandable. And
Yeah. I think something that I think is really interesting about what you do too is that you developed your own like proprietary software for facial balancing.
Yeah, I built that one.
So I was like, okay, a traditional medicine clinic, but she's like building software. I'm like, okay, this is kind of like badass.
Yes,
number
like
one.
wisdom from ancient and it adapted to modern life.
Totally.
Yeah.
Totally.
So the common myth or misconception about Korean medicine is, I guess, is that everybody think it's like ancient history. But actually it's not. It's still part of the national health insurance system and it's still evolving. And there is a numerous research about ingredient and there is a lot of more scientific effect about the acupuncture and treating method. So it's still evolving.
Totally. Do you think it's getting, because I think there's like a kind of a distinction maybe between like, do you call it modern medicine or what do you call like traditional medicine?
In Korea, we call this, interestingly, we call this 양의학. So yang means 서양. It's like Western. So we call literally just Western medicine. Or just modern medicine.
Got it.
In Korea, it's like Korean traditional medicine or Korean medicine.
Totally. Because I think with more like, we'll just call it Western medicine, it always has to be so quantifiable. Like you always have to see like data, you have to see improvements where it's like, with like TKM, it's kind of like with my shoulder, like there's no way you could have charted, like there's no graph that could have been like, we reduced her pain in my shoulders or whatever. But it's something that it just like once you experience it, it just works.
Yeah.
So there's a little bit of a like I think a difference there, but maybe
it's like modern medicine often needs a clear like disease to start the treatment or start like
we have to diagnose you first.
Yeah, diagnose it first, and we need clear lab data. Like MRI, and then if the blood test shows nothing, they cannot start to treat you. But the difference lies in that Korean traditional medicine categorize your body's pattern. That's first. For example, like you're right now, I can tell you're low energy or extreme energy, or you are now in the situation of excess heat or deficiency on heat like that. So we measure the balance between the yin and yang or energy or heat like that. That's like we treat a body when when even though if you feel okay, but if you feel slightly uncomfortable, but if there still has a power to heal itself, we can start the treatment immediately because we figure out your pattern.
Right.
Then we can start the treatment.
Totally.
Because we don't need diagnosis, because we can patternize your body and we can figure out which stage you are.
So if you're like, I haven't been sleeping for like 3 months, or like I haven't been, or just like I have pain here, but like, yeah, like you're saying, like nothing would show up on like a, either if it's like an MRI, X-ray or something, like they're like, oh, everything looks fine. You must be fine. That you can just like go ahead and just start like treating. Can I ask you that one day you took my pulse and you knew I hadn't eaten lunch?
Yeah.
And I was like,
so
what else do you know about just looking at me? I was so like...
Yeah, so because I knew you before.
Yeah. I've been lunch.
I'm like, I was trying to detect you. Like, we believe in like treating the pre-disease stage. So we have to be really, really careful about our patient current like stage, or like, because if you feel tired, like heavy, or if you feel like you're out of balance, like your body is sending a signal. My job is to catch those signals.
Oh my God, that's so like badass. That's so cool.
Even though you are not noticing that, but your body felt fatigued.
And maybe we can talk about the meaning of the word Duna, which is such a cool meaning as well. But like, I just...
You're the Duna.
I am the Duna, yeah.
You're
because like especially coming from like my, like I said, I talk about consulting all the time because it has traumatized me. But in a lot of times, especially when you have like a corporate job, you kind of like, you just focus on your head and you kind of ignore, you're like, oh, I'm tired or I'm exhausted or whatever. It's like, doesn't matter. You got to get your work done.
You have to keep going on.
Right. Yeah. And so I've never been in tune with my body. Like, it's just like, oh, if it hurts, just kind of ignore it, which is also, I think, a little bit of an American kind of approach to wellness. But I think you would always know things about me just because you're so observant. But like you said, you're there to like catch those. Yeah, you're catching those signals. Yeah. And I'm just like, I'm not paying attention to the signals. I was like, I want the signals to go away and I just want to be well. And it doesn't work like that.
So in Korean medicine, we call great doctor is the doctor who can detect a patient's signal before it gets into the real stage of disease. We call this 미병, 치병. So 미병 means pre-disease, and 치병 means cure. So before even the disease exists, this is our job to detect, like saying again, detect your signal, like uncomfortable signals from your body.
Totally. There's also that day you were adjusting my neck. I saw some stories of you, and you're like, "Is your knee hurt?" And I'm like, "Yeah, it does." You're like, "Yeah, I can see that it hurts," and I'm like, "What?"
Like, sometimes I shocked about. They are literally like, for my clients and patients, they are literally like, there is a huge cracking sound, and they thought it was like minor problem. Like with Korean insurance, they will definitely come to, actually they will go orthopedic clinic first. And then if the test results are clear, they might come to Korean medicine clinic to care themselves.
Totally.
Yeah, so there is a step for Korean. So once you got hurt, then definitely you can see that's a big injury, or you ignore the signals from your body for so long. And if you are aware of that, you might go to big hospital. And annual health checkup is a thing in Korea, right?
Yeah.
So they can regularly check their whole body, like scan and MRI. And then if there is no problem, if the data are all clean, they have another option. They can go Korean medicine clinic. So it's really grateful to say that as a Korean, I also have an option like that.
Yeah, no, totally. Do you have people that bring, because I think you told me once that like you can bring like your blood labs to you.
Yeah.
And then
actually we also testify blood too. So for example, because we cares a lot of like clients who need support and like in weight loss journey. So my job is not only treating clients, but also make sure that feel safe. So the blind point of Korean medicine is that they kind of misunderstand that they are doing well or they are underprotected like that. So anyway, we need some data to client to feel secured and safe.
Yeah. Like, you kind of want to like see, you know, like you've said this before, like people love numbers. They love the thing like that. Yeah.
Yeah, we I think for numbers, we shouldn't ignore that because at the stage of disease, once the number arrives, is the time your body cannot control their own itself. So it's time to go to the hospital. But before that, the gray area is there is so numerous like methods and diets and lifestyle that treat by yourself. That's what we do, like practical guide. As a
Totally. Yeah. There's a common misconception that I had was like, I just thought like traditional medicine doctors would like not believe in like Western medicine, or they would be like, oh no, that, you know, it's all bad. It's all, but like the way that you, or that I learned from you is that like, no, you need both. And it's not Eastern versus traditional. Like it's all medicine.
Yeah.
Like it's just medicine.
Honestly, it's my personal idea, but I'm sure like majority of Korean medicine doctors will agree with me. Like, for example, about modern dermatology. It's trending right now.
Yeah.
And they treat like skin as isolated organ. I think the lenses view the same skin problem is different.
Yeah.
So if there is a problem on surface, if you want to delete that immediately, you need to go to dermatology. So like with what you prioritize in is different. So if you want to just focus on the surface using creams or steroids or lasers to fix the visible problem, so you may want to, if you might want to just delete that immediately. So it's highly effective for fast result. But after the years of Korean medicine practitioner, I realized that there are so many patients and people who just don't want to get like using
Quick results.
because they want to treat from fundamental.
Right. Because
So-
otherwise you're in that cycle of
Yeah.
like having to go back
Yeah,
to.
it'd be lucky if you're just using creams or like lasers, and if that just disappear, it would be nice because that means it just eliminate the surface and your body's working well to not making that again. But in Korean medicine, so we believe the skin is like a reflection of your internal health, like that. So in my case, I have a huge pimple on my left cheek. So it's directly linked and connected to my stomach and spleen health.
Yeah.
So that means I ate a lot of greasy food these days.
Yeah.
I slept a lot. I
Didn't sleep enough.
didn't sleep enough. And it reflects my poor blood circulation and my stress level. So if there is a skin flaring up, so we don't just look up the skin, and we need some treatment for the surface. But if you want to just eliminate the fundamental reason why it's happening, we have to look at the underneath.
So if people really want Korean glass skin,
Yeah.
they got to take care of their stomach and their gut, which I will say, I think the best my skin has ever looked was this past summer when I was doing the
Herbal tea.
the herbal teas.
Yeah, and then you combined with your lifestyle.
And then, yeah.
You
and I was-
carried that, and then you brought that everywhere you go, and then you did some exercise, right?
Yeah, I was like walking every day. I was sleeping well. And everyone was like, what treatments are you doing? Because, you know, I do a lot of treatments. And I was like, I actually haven't really been doing a lot. I was like, I've been taking these teas. And I was like, I brought him to the beach that one day. Like,
That's so lovely to hear that
Yeah.
because you followed the old rules.
but also too, like, I think people just assume like, oh, it must be the treatments. And I was like, no. I was like, I've figured out my digestion and like I took care of my stomach and my gut and everything, which I don't think that was never the goal, right? I was never like, I want to fix my skin. How can I do that? But I think it's just such a strong like byproduct of taking care of your life to have good skin.
The principle of that herbal tea was like kind of that to boost your metabolism faster, and second was like make you sweat a lot. And
I mean, it was summer in Korea, so like you're sweating no matter what.
yeah, so you're already sweating a lot, but
getting like toxins out.
Yeah, and then the toxin out, and it detoxified your blood, and then it's same as the pills you're taking. So in modern Korean medicine, we differentiate the form, and the formula, so it make easier to carry and easier to take. I think it's also the development and then evolve.
Yeah. No, absolutely. Yeah, and I think, like you were saying too, like doing the teas first, like prepped my body basically to take like more like like herbal capsules, and
it's more easy to carry for pills, but the effect is much more beneficial with the herbal tea.
Yeah.
Because it's much more personalized to you. So the concept of personalization is also in Korean medicine.
Yeah, I feel like this is turning into me just like fangirling over you all the time. But like,
Thank you.
no, but it's so personal. But also too, I think when I first sat down with you, I was like, I could tell that you wanted me to get better. It wasn't like
Genuinely.
It wasn't like it wasn't like I'm a doctor and I want you to listen to me and like do what and there was no like shame. It wasn't like you're not taking care of yourself. You were just like, you're not as well as you could be, and you could be
Better version of you.
Yeah. Okay, let's talk about Duna then. Let's talk about the meaning of Duna.
So that makes everything easy. So Duna means like 두 번째나 in Korea. So it's like version 2. So I wanted to everybody coming to Duna find second themselves, so second myself after meeting traditional Korean medicine. So I wanted to them feel better and regain confidence and restore their healthy lifestyle back after meeting Korean medicine. So I named that way like version 2, like 두 번째나. So I didn't want to make it like new me. That's too far away.
Right.
New me? What are you?
What is that? Who is that? I don't know her.
So it's too far away because like I thought the client made the decision to come here. So they made the decision, I want better version of me. I want to be better than yesterday. So Duna was just there and they made the decision. I wanted to make that clear. So that's the reason why I made it just Duna. And the concept itself came after, like, it was like almost like 9 years ago. So I was just a kid. And like I was very eggy. And then there was a 할아버지 patient.
Oh yeah. I want to hear about this patient.
Yeah. So the patient was quite old enough. Like we quite assumed that maybe older people are more used to Korean medicine, right? But actually, it's like I told you, 60% of Korean adults coming to like Korean medicine clinic, they experience. But what else? Like 40%.
Yeah.
He was the 40%. So he never experienced like Korean medicine entire his life until he hit 80.
Wow. That's kind of surprising to me.
Yeah. So it was like that. So he suffered from like such a chronic diseases and including some like muscle ache and insomnia, and he took a bunch of different painkillers and even for sleeping pills because the pain was too severe. And in Korea, a high level of painkiller are not allowed for normal clients, normal patients. So his only option was taking like sleeping pill around 6 p.m. and go to bed earlier
escape the pain.
Yeah.
Oh, that's so sad.
But he was very sus at first, like
Skeptical. He was like,
I don't trust you like
if
that.
If you spend 80 years in Korea and not going, you would have to be skeptical.
He can be like stubborn at what he's been doing for his whole life. And then I treated it with very basic skills, basic acupuncture, but I didn't really like tried like Tuna or like herbal medicine. I just did basic acupuncture. And after the first acupuncture session, he came to me and he bowed to me. Literally, he bowed to me. And you know the meaning of bow in Korea for old men is a huge reflection of respect.
Totally.
And he bowed me and told me, I'm regretting the whole rest of my life.
Did you cry? Oh my God.
Not really, because I'm P.
Oh my! I wondered how long it would take to get the MBT.
It was quite emotional, and then like I was so grateful he said so like genuinely, because like he regretted the whole life, and then he told me I'm better version of me because of you, and then I'm regretting the whole rest of my life. Why didn't I just try the Korean medicine just for one time, and that I might be much more better in life quality like that. And then it started from that. So Duna's first idea was start from that. Well, someday I'll make my new clinic, like I'll name after it, and then maybe the clinic would be full of people and clients who never experienced Korean medicine before. That's my idea. It starts from that, really. So for Korean medicine, for general Korean medicine doctor, when they face like a suspicious patient, they feel stressed. Like if they come with the face they don't trust, or if they want to be persuaded, hey, show what you got.
Make me believe. Yeah, make me believe.
They feel tired. But for me, I literally enjoyed the moment because that was the moment I was waiting.
Yeah.
So I was ready to persuade you. So this is my plan. So I had this experience, and the majority of the people came with the same problem, had these symptoms, and you're quite similar to that. And I'd like to treat you in this way. If you feel safe in when I tell you like this, I'll be your like practical wellness guy, like that.
Yeah.
And people changes. And then
because why not? I mean, they're already there.
Yeah.
Like you said, they're already there because something else wasn't working.
Yeah, so I set the goal for initial start that, I'll be fixing the people who have never treated their body well before. So I think the start line was different than others. Yeah. So I wasn't that afraid of like non-Korean clients coming to Duna because they are just people.
Yeah.
They just needed help, and that's all. You're older.
tea.
Yeah.
At the end of the day, you're a tea.
Yeah, just because they are not speaking Korean doesn't mean they are not allowed or they are not welcome to come to the clinic. I think so.
Yeah. I mean, it's almost an even better reason because they probably just aren't. Well, I think too, they just don't have an understanding. Like if people are skeptical, I think they just don't understand what it is. Like I was super curious.
It's a medicine for people who want to take the driver's seat on their
On their own, like health. Yeah.
Health way, health journey. It's perfect fit for you. But if you want to be too persuaded, and if you need some visual conviction, you're not fit for that.
Yeah.
And then it's also not for people who just want instant change after one session or after just one shot treatment.
Yeah. Yeah.
If they are not changing their lifestyle,
then what's the point?
Yeah.
Yeah.
So imagine you're still eating unhealthy food, expecting your body to get better.
Yeah.
It's kind of
just isn't.
Mental issue.
Yeah, totally. You're crazy. So what do you think your patient base is now, of people that are coming to do traditional medicine for the first time versus people that are I know it works, I just want my tuna or my acupuncture or whatever.
You mean
right now, how many patients But you've also had like a really crazy growth. So you haven't really had like a steady baseline.
So it's
but like how many of your patients are like coming to you for like, I've never had traditional medicine before?
so in those terms of view, and then so actually basically like still 50% of our whole client is still Korean, local Korean, coming for everyday, like for daily wellness or like from car accident or for posture correction and for herbal medicine or 사상체질 or like for pace constitutional treatment. But the rest of like 50% of our client is still coming from all over the globe. Like the majority of them are the clients from US, like almost 80%.
Oh, wow.
I'll give you the number.
Look at
So
the
actually,
data.
we searched our like 6 months of data. We tracked them back like last week, and let's say we got some like thousands of requests, of booking requests, and our capacity is we can hold like 30% of that request.
Wow.
Yeah. Sorry for the like canceled booking appointment.
I saw like in October, you were like,
Yeah.
you made this post that like we just have too many people coming.
Yeah.
And I think probably spikes in like the spring and like the fall, which are just higher
actually,
tourism.
we cannot expect. So we cannot expect like how many booking requests will come because sometimes the like people with high influence came to Duna clinic and they record something and we didn't know, and then they post randomly, and then there is a like global interest, like flood. Sometimes
Like all these people reaching out.
it's like 100 booking requests for every day like that, and at that moment we had to block all the booking appointment. Anyway, so thanks to, I'm so grateful that everyone wants this type of like holistic approach in Korean medicine, and we like recorded like 500% growth.
That's insane. Wow.
Back from the start. So like when I compare like 2002 and then 2025, there was like 500% growth.
That's insane.
Yeah,
So you need to have like 10 other locations.
maybe. Yeah.
Maybe.
So it's like that. I want to hold my value strongly
Yeah.
because I know some other CEOs and like directors or founders, they easily lose their core value if you just want to focus on expansion and growth.
Yeah.
So I think growth is the result, not the reason.
Not the reason. That
Yeah.
totally makes sense. But what about people that can only come? Like, so let's say it's like, you know, we're doing a girls' trip, we're going to be in Seoul, and they want to try it. Because I do.
Like a one-time visitor.
Yeah, because I do have people that ask me, they're like, well, what if I can only go once? Like, what's the point? I'm like, I was like, my first appointment blew my
I
mind.
should answer that question too. So whenever I face those type of clients, and then when they enter my office, I ask them, are you okay to listen some lecture about your body?
Are you prepared to hear about yourself?
Yeah.
You know, that's actually good that you prep them for that.
Yeah.
Because, like I said, like what you can tell about a person is kind of mind blowing. Yeah.
So it's always 100% yes. Why not? So what they wanted to know about was why these all the symptoms and problems came from. Like, even though, like, for me, myself, and when I got hurt or sick, I felt unwell, I kept questioning myself, like, why this all came from? Like, genuine questions, like, wondering inside my head, like, they are full of the questions I should answer.
Yeah.
So normally, for the first session, I use the whole time and the whole session as a test trial, and try to answer back every question they are questioned about their body. What should I eat? What should I do? Like, for example, like quick stretching, from quick stretching, or like food I should avoid, and what baseline I have, like that. So, and then normally they want to visit again.
I've had clients that have come and they're like, okay, we'll do Duna. And then, and then I've had other people be like, oh, we canceled like 3 other appointments. We can come back to Duna.
Oh my God.
And they were like,
so lovely.
Like, I really wanted to have my like hair done, but we canceled it because we got to go back to Duna. So I'm like, I told you guys. It's
Thank
good.
you.
Yeah.
It means a lot to me because I was one of the like patients. It starts from that. So what if I was same as them? Like, what if I didn't find any answer from the area I live and then flew all over the
took a 14-hour flight.
Yeah, full 14-hour flight to find true wellness, and then I should answer them back with like some information.
Yeah, totally.
So it's truly worth it if you're just open to listening, and even though without like saying or without lecture, it totally worth it. So because actually Korean medicine is very, very practical. So
super practical.
yeah,
it makes sense.
Yeah, if it's not effective, it will disappear.
Yeah.
It's not like a science.
That's a fair point. Yeah.
Yeah.
It wouldn't be around for thousands of years.
Yeah.
If it didn't work.
So yeah, it's like that. So you want to get acupuncture without effect?
Yeah, no. Like, what's the point? I mean, I will say sometimes, like during the winter, it's like really nice to just like, because it's always so warm in Duna. So I'm like, it's always just like really comforting to be in there, and then to just like the beds are warm, so that's kind of nice.
Yeah, that's my idea. Like that's my goal, to make everybody sleep well.
Yeah.
So I once joined the research about like how acupuncture or acupressure can calm down the nerve system, and it really worked. So maybe you might sleep well after some acupuncture.
I do.
Yeah, you feel really, really sleepy because acupuncture triggers the outer part of our body, and it can literally calm down our inside because there is so many like stimulation coming from outside.
Yeah.
So yeah, that's
Totally.
like basic principle of acupuncture, but it might be too long if I say all that. Anyway, so if there is no effect, people will never get acupunctured. Like they never want needle.
Right.
Like everybody's saying that like, sorry, doctor, I'm so afraid of needles. And if you're a fan of needles, I'm afraid of you.
Yeah, totally. Yeah, I just love needles. Let me just,
wait.
give me a couple needles, please. And you're like, that's not what we do here. Like, that's a little bit different. I did start sleeping a lot better once I moved to Korea. Not the first time, but definitely like now that I'm like permanently here, I definitely started sleeping better. And people are like, oh, maybe it's just because, it's a better fit, like culturally, like maybe you just like found your true home. And I'm like, no, I think it's because I started doing acupuncture and like started taking care of my body. It's probably a little bit more of that, but
Yeah, the idea and concept that I'm the control, I'm the like driver of my body. It pleased me.
totally, it's a game changer, like mentally.
Sometimes clients feel very hopeless or like they feel very insecure about their body, can actually harm their confidence. Like, oh, I want to start this business, I want to start this and exercise, but I'm not sure I can finish that, I can manage that. So if there is not even a cure, if there is a solution or like way to treat yourself without like medication.
Yeah,
I think that's the reason why everybody loves Korean medicine.
totally. That's like, I don't even really like to take like a Tylenol. You know what I mean? It's always kind of like, it always feels weird to me, but
Yeah, so if there is a fire, like it's just like instant relief. We are just going blind with like painkillers.
Yeah. Oh, totally. And like you said too, it doesn't, like if you have a pain in your shoulder, like I always had pain in my shoulder, and like if I'm taking a Tylenol, like my body's going to distribute like the painkiller. It's not like targeted.
Yeah, so it's like that. If you see some broken window, we should fix them into right position.
Yeah.
But what if you just cut out the edge?
Yeah.
It's not right.
Yeah, totally.
Yeah, about the movie, so movie and dramas. So there are many dramas and K-dramas, like the host or the main characters are Korean medicine doctor, usually it described as very kind and nice, gentle person. I think
Not tea.
Usually it's the totally opposite to modern medicine doctor. Like it described as like that.
Yeah.
So it's kind of character. Like,
Right.
So if there is in K-drama, if you have like Korean medicine doctor boyfriend, like everybody will admire you. Oh, he'll be super kind and sweet.
Oh, yeah.
And he will
Yeah.
listen everything.
Totally.
He will listen every like complaining, whining, but
Treat you like a princess.
yeah, but actually, listening to our patient saying is part of our treating journey.
Yeah.
He's doing his job.
It's like part therapy, part actual medicine. Yeah.
But usually, I heard the feedback from a client from another country abroad is also saying like, in general, Korean medicine doctors are really, really sweet and kind. That's the most of the feedback I've most listened to.
I mean, they are at Duna. I mean, it's even if people don't have you, like if they have like Dr. Lee or
Dr. Lee.
the other doctor, there's Dr. Kim. Right?
Again,
Yeah.
Dr. Lee. And
Yeah.
Dr. Kim.
But they're like no matter what, like was it hard for you to find other doctors that are at the same kind of level of you, or like?
So it's for me, hiring staff and the medical team is number one prioritized thing to me. It's like the most like value I pursue when I running my medical business, Duna, is that make sure my client to feel the hospitality.
Mm-hmm.
It might sound a little too like normal, but it's really, really hard to like genuinely feel the feeling of hospitality.
Mm-hmm. Especially as you're growing.
Yeah.
Yeah.
So there will be so many appointments. There will be so many like other clients, and you have to pay attention to this one, and you have to prescribe some medicine, and you have to do correction, and you have to answer the phone. It's really hard to like handle all the situation.
And still like maintain that tone.
Maintain
of,
the
like,
tone. So my priority is in finding a appropriate person who can fit into this role.
Mm-hmm.
So I always like mentioning about how value their job is.
Yeah.
We are not doing like tasking like ordinary job.
Mm-hmm.
Like we are in the main like part of the healing journey.
It's kind of in a pretty big contrast from like Bali culture, where it's like just go in, do it, make it efficient.
Yeah.
And it's just it's not that.
Actually, we are acting Bali, but the tone is like
But like
calm,
behind the
moderate.
scenes. Yeah. I want to talk about supplements really quick.
Oh, okay. You can ask
Like the
that.
whole like olive better. Like I think
Give me the big question.
like big question is, do you think supplements are legit?
Oh.
Or like what is your thought on like supplements if you're going to like the olive better or like supplements you can get at like the grocery store versus
That's
like herbal?
Yeah, that's kind of like big question. And then everybody asked about that too, because around our clinic there is a big giant olivion.
A huge olive,
Yeah.
And like 13
World best olivion.
You can see it from the window, yeah.
I think there is a difference. That's my answer. And the difference lies in precision. So precision, like, so about herbal supplements, it's for general function. So for general function means it's safe for everyone. So in Korea, the regulation and kind of rules for the supplements and herbal ingredient is quite strict. Like if the benefit and effect of some herbal ingredient are too effective or too strong, you cannot find that one in olivion.
Even like melatonin.
Like
you can't get melatonin in Korea, right?
yeah, like
Because of sleep.
yeah,
Yeah.
So not only about the melatonin, about the herbal supplements, herbal ingredients. Like there is a more than 500 and around 10 or around thousands of like herbal ingredients based in South Korea alone, and they categorize into the zone like herbal supplement zone and herbal medication zone. It there is a boundary. So once it's okay to be made as a herbal like supplements, it means it's sometimes it's too general or too mild to classify it as medicine. So that means they provide a broad boost, but it's not like targeted.
Like actually.
Yeah. So it's for general function. So
Yeah.
that means if you need some help or if you want to target some symptom, we use like precise tool like clinical data like I do. We need to analyze you.
Like track it.
Yeah, to
make
track,
sure that there is actually improvement happening.
To give you the medicine under your specific constitution or baseline.
Right.
So while like supplements offer like general support, the herbal medicine is for like being tailored to you. So it's completely normal in Korea to seek a herbal supplement for daily dose, for daily like routine.
Yeah.
But once you are finding out you're losing balance, you may come to Korean medicine clinic.
Yeah.
So the ingredients not great, the category is different. For
Got
example,
it.
the ephedrine in like weight loss pill, you should consider it as like medicine because it can harm people's like stomach or like nerve system.
Yeah.
If the doses are too high, but it's still too effective to consider it as herbal supplement, even though it's for weight loss.
Yeah.
So you can only prescribe that inside Korean medicine only or pharmacy.
Yeah.
So pharmacy is like, I think for overall health supplement and overall wellness product, I recommend pharmacy more because they are both specialized in modern medicine and both Korean medicine because Korean pharmacy also they have to graduate 6-year course.
Yeah.
And they have to pass the exam of Korean medicine and normal medicine together.
Got it.
And so there is a lot of like general medicine product in Korea. So when you got sick and when you feel unwell and whenever you go to just normal Korean pharmacy, they'll give you like mixture of Korean medicine and modern medicine.
Yeah, totally.
Yeah, like maybe if you're having bad throat, like if there is inflammation around your throat, they'll give you eungyosan, which is like very bad taste.
The worst. It's
Yeah,
really
because the sour or like bitter taste actually calm down the inflammation. Theoretically, 근데 so if you're looking for like health supplements, which is really really effective, if you want the benefit, you may go to the pharmacy rather than Olivia.
Got it. But are there any supplements that you think in general are good for people? Because there's kind of the argument that it's like if you're not getting what you need from your food, like change your diet before you want like a supplement. But there's always like, different.
For just a normal supplement, something I want people to avoid is about lemon.
Really?
Yeah.
So people that are taking like olive oil and lemon juice shots in the morning.
Yeah, that's
too acidic.
Yeah, that's too aggressive for stomach.
What about like apple cider vinegar? Like people, I used to do that. I would take like a shot at like half a shot of like apple cider vinegar.
So it's beneficial to like decrease the blood sugar level, but in general, you have to think about your body baseline too.
Yeah.
Again, so if your stomach is strong enough to digest
pure lemon juice.
Yeah, pure lemon juice every day. There is a type called like 소양인, and so which means literally like their like stomach and spleen system is really, really powerful to digest everything. But they always suffer from excess heat because their like activation system is too.
Are a lot of guys that?
It's not about guy and girls. It's more about like
Just
which
actual constitution.
which organ strengths are more powerful and which organs are much more weaker. So about the health supplements, there is a guide for Korean medicine also. So in Korean medicine, we categorize people into 4 phase typology, and there is a guide for exercise and like lifestyle routine, and also for herbal supplements and about the fruits and everything. So basically, me and you is 태음인, which means like bigger in person. We are allowed to eat or try fermented food. So there is a supplement with fermented tofu like that. So that's one of the recommendations. Like or magnesium.
You always told me to like drink warm, like make sure you're like warm foods versus like not a cold salad.
Yeah. So basically, 태음인 person has both yin and yang. It's kind of like deep theory, but kind of simple. Deep, but both simple. So you're having both yin part in your body and yang part in your body both, but it's really important to keep balance. So don't like try same salad every day was my like advice that moment.
Yeah.
So back to the question. So health supplements are also should be considered as like you should follow your baseline. That's Korean medicine idea. And if there is one supplement I'd like to recommend for women is suk. Suk is very mild and generally is usually for women's womb circulation. Because these days every like product is too processed and we have to sit all day long at the desk, so our womb and the pelvic alignment got worsened. So it's it's quite nice to
if you're sitting all day. Why did I never put that together, that it would like I feel like so many women have issues with like their pelvic floor and like that's kind of a thing, but and then again, this is like it's like connecting the dots of like if you're sitting all day, like that's not, your body's not meant to like sitting like this.
So actually I found some research about like how many hours a human being should walk 1,000 years ago. It was like 8 hours of straight walk.
Oh my gosh.
Yeah.
And now we
are designed we are designed to walk 8 hours straight, but now we are
we're just trying to get 10,000. We're just trying to get 10,000 steps in a day. I've also heard that like if you get 10,000 steps a day, that you're basically, or no, is it like 5,000? You're basically considered like sedentary. That means like you don't move. Like 5,000 is like nothing.
Yeah. So human being is one of the animals can actually walk quite long all day. And then that's very, very interesting, right?
So interesting.
I told you, like, even though we are living in modern society, our body are still stuck in past.
Right.
So the principle from past can actually help today's disease.
Totally. And I don't think, at least I've never thought about like supplementing. Like you always think supplements are like vitamin D if you don't get enough sun, or like like people talk about glutathione if they want to like brighten their skin, but like I wouldn't think to look for a supplement because I sit all day. That's so interesting.
So like there was a super famous like Korean medicine scholar called Lee Jae-ma. Once again, he developed that 4 phase typology or constitution. So that was one of the distinct like thing from TCM and Japanese medicine. It differentiates on stage, like which stage we are going to step in. So for Japanese, they go into at the end of the disease for chronic disease. So at Japan, Japanese doctor have to graduate normal medical school. Then they can step into holistic, or they can prescribe kampo. So kampo means like herbal powder. So they use kampo as a backup treatment for chronic disease. For middle stage, like the actual disease stage, Chinese medicine can step in. So they treat Chinese medicine 101 same as tool equal to modern medicine. So they actively use the Chinese medicine tool to defeat the symptom. So for example, they might combine IV or even for laser or Tylenol for like viruses. There was a like Nobel winning prize who was Chinese medicine doctor also. So, and also Chinese government allows more like right to Chinese medicine doctor. So they use the Chinese medicine as a powerful tool to actually defeat the symptom or disease. So they use the Chinese medicine as a stage of disease. But in Korean medicine, it's really important to like prevent disease.
Right.
So we enter at presentative area. So about the wellness, back to modern days. So about the wellness, it's all about maintaining our body healthier and take control about our bodies and mind, right? So I think the Korean medicine's like perspective that about like we should like protect our body or maintain our body healthier before actual disease hits makes sense.
100%. And also something that you've mentioned as well is like wellness shouldn't be a luxury.
So it's like I heard that from like client from abroad also. So she mentioned about like thinking about health was kind of pressure for her, because that means maintaining health was about going to hospital. Going to hospital means going to spend a lot of money.
Yeah.
But these days there is a lot of like, as you mentioned about, is reels or creators always posting about their life, right?
It's like the wellness, So
the East girls, like
there was,
clean girl routine.
Yeah, there's like clean girl routine, or there's like I think there was a TikTok trend like that. It was like becoming Chinese or something. And then it was like people that had just discovered like Jujubee.
Jujubee.
And they're like, oh, I'm Chinese now, and you're like, and so then there was just all these women that were like, you guys, this stuff has been around forever. Like, what are you talking about? Like, just kind of looking ridiculous. But also, too, there was a little bit of like, yeah, this is like legit and it's real.
I have one question. Did that influence you?
No, that was like after. I mean, so that, I think that was kind of like a couple of months ago, or maybe this summer, that was like a TikTok trend. But no, I mean, a little bit was kind of like,
I think that's influencing the people who have never experienced the rigid like medicine or like Eastern medicine before.
Right.
But it can influence them to step into or curious about what's more than that, like that. So it's like watching those trends are quite highly positive to me. Like everything should look fun. Right? Like,
oh, totally.
Yeah, handling about health and managing health should not considered as boring thing.
Yeah.
But, making trend and making reels, they are like giving video every day with like clean girl routine, and they showing off, they are like actually caring about themselves. That gives such a vibe that like for Jujubee tea, for example, you can buy that for like less than $1, like that, and then
or you can buy it for like, I mean, there's like influencers selling it for
they
like
are selling
$60,
too.
like, yeah. But that's what I kind of liked about the trend. It was like, it was more about like information versus like people
Weird.
selling things. It wasn't like, I have this retinol and it's amazing. It was just kind of like, I think there's a little bit of like being predatory
Yeah.
when you're talking about wellness.
Yeah.
Because sometimes people are very, like, because there is a lot of like unwellness in the world. And like, you know, people have a lot of pain, they have a lot of struggles. And so then they see all this stuff on TikTok and they're like, maybe this will work. And it's like,
Yeah, I even saw some reels about like right now it's like World War III is happening, and then now I'm doing my wellness trend like that.
yeah, I have a lot of that because, you know, the business that I run is about like, like traveling to Korea for skin treatment. How do I talk about Botox all day when it's like, it's literally my country's falling apart, but it's, yeah.
Yeah, but I think everything has pros and cons.
Yeah.
So
It's about balance.
yeah, it's about balance. So good thing about it is it can influence people who have never interest about their health in their daily routine, and it's not that luxurious to have that routine. So what you can do is just what you have to do is just trying some tea and do some acupressure and like doing some
Put your
like,
phone down.
yeah, and then doing some hot packs around your belly like that. Yeah, so it's I think it's quite like positive vibes in both, but if that overused, it's kind of like so to me.
Yeah.
Yeah,
Like
but,
it can be, like you're saying, it needs to be
Yeah.
personalized.
yeah, but in general, I like it because with that trend for a client coming to our clinic, actually like influenced with that. Oh, what should I do for my daily routine like this? If you can you give me advice like that? Because they come after seeing that reels, but actually they need the real. They know it. That's not weird thing. That's like fake.
Yeah.
Like thing, but they really want to get some real advice from me or like professionals. So I think it's highly like positive
Yeah,
in both ways.
totally.
Yeah. So I have one question.
Oh, you're going to ask me questions?
Yeah, I like.
Okay.
Have you ever like got some feedback from a client from Duna clinic that they have ever recommended like our clinic to others like that, or like any other feedback?
Yeah, there's a few. Like I just talked to somebody last week who, I think she came and saw you last spring, and now she's she's bringing her family. They're gonna be here, and
That's so lovely.
yeah, so she's like, I'm gonna bring my daughter.
Yeah.
And
So bringing the family is one of the most fantastic thing ever that happened to the clinic.
yeah. Or there was, I had a client from Singapore. She comes and sees you every time. She's gonna come and see you again. And
I love Singapore people.
yeah, but she
They're
brought
so cool.
Yeah, like she brought her father, and she's
Yeah.
like, my father kind of was like, not, I don't know if he was really skeptical, but he was kind of like, yeah, I'm familiar with it. It is what it is. But then like after the treatment, she was like, my father was impressed, and she's like, nothing impresses my father. And so, I think she kind of, she does come to Korea kind of frequently, like maybe 2 or 3 times a year, but she's always like now she comes and like she stays in Seongsu to be close to
Yeah.
so.
It's so interesting that every client you're bringing is highly like intelligent people sometimes. Like that surprised me. Like they already searched everything about Korean medicine, and including like skincare and including like spas, and they all already like searched it in detail, and they are not just coming with like no idea.
Yeah.
And then it felt me such a relief that I can care those type of special client thanks to you.
They have a little bit of a higher like expectation,
Yeah.
or they want a little bit more. I feel like the people that find Docent or that are kind of drawn to what it is, like they want the information, and they are, they might be skeptical, maybe not, but there are people that want to do their own research, and they want to be informed going in, and they don't want to be sold to. And so that's why I feel like, the people which is a good reason why I send people to you, because I'm like, there's no BS here. And if you want like a good thing that you can't really experience at a lot of other places.
I should always like try my best to fit that standard.
Oh, you do?
Yeah, thank you.
I feel like you don't, but it's something that you don't, it's like deeply ingrained. You know, it's not something you like have to try to do, and it's very genuine and authentic. And I think that's also something people really are looking for and just kind of craving in this like world that we have. So I think that's a big reason why like people want to come and actually learn more about it. Like they understand the connections of like inflammation and like lymphatic system and how that.
Yeah, in general, like Korean doctors are very nice.
Yeah.
Yeah, based on
totally.
my experience.
Yeah. 100%. Well, I think that puts us at time, but I could talk to you for hours about this stuff. Maybe we'll have you come back. But thank you so much for sharing and kind of introducing TKM to everybody and all of the like docent clients that we've had so far that just like, not that they were ever suspicious, but they're all like very much believers in just like the concept of taking care of your body, like cultivating your life, nurturing your life. So, yeah, thank you so much.
Yeah, I was so great to be here. And then the thing about the wellness and Korean medicine is that there is a rising attention and global interest on wellness these days. And I have the feeling that like Korea can be the next like global wellness hub within like 5 to 10 years.
Yeah.
More than this.
Totally.
Yeah, so probably Korean medicine can be some role in that pod.
I feel like you're going to be the next. I forget that guy's name that wrote that book. That everybody knows. Yeah, you're going to be the next one. It's going to be like Dr. Kim.
He isolated it.
Okay, well. On that note, thank you so much for coming.
Thank you for having me. I wish to come back here again.
Perfect.